Big Buddha's hanging out this morning at Hamblin Dental. He's learning about dental procedures. You going back to school, get a new career this morning or something?
People who need work done on their teeth, they probably don't want these big bananas in their mouths. So, no, I'm not going back to school to be a dentist, but we are here, teeth in an hour. So we got Dr. Scott Hamblin here. He's our dentist. We also have our patient, Susan. We'll talk to her in just a little bit. So teeth in an hour, is that really possible?
Absolutely. New technology with a CAT scan and computer software makes it, I've seen it done in 22 minutes, a whole set of teeth done in 22 minutes.
So let's do it in 22 minutes then.
Well, we're scheduled for 3 hours today, so
see, the first time, give me a high five. I like that. Right. A man who knows exactly it's television. We got to tease it and stretch it out, and so 22 minutes, huh?
22 minutes, yeah.
3 hours. We're gonna do 3 hours.
In our next segment, we'll be putting in 3 implants, and we'll probably do it in about 5 or 6 minutes.
Implants. I saw that implant. What does that mean? What does an implant actually do? What is it?
It's a natural tooth replacement, root replacement. So it replaces the root part of the tooth, and you can anchor teeth, you can anchor crowns, you can anchor bridges. It gives people rock solid teeth so they can chew and eat, and it gives them back their quality of life.
Okay, so what kind of work are we going to do over here, Susan? Now come over here, doctor, while we look over here. You don't mind if we take a look, right?
No.
Okay.
That's why I'm here.
I love it. It's about, no. Okay, so if you don't mind, show us where we're going to be working on while Dr. Hamblin tells us what we're going to do.
Basically, all she has is five or six teeth left on top. She has no back teeth, so we're going to be putting 3 implants in on both sides, on each side, and then also we're going to be replacing the front 6 crowns that she has. Earlier, a few months ago, we did implants on her lower jaw, so she has teeth to chew with down there now, and but today we're going to be doing her whole upper jaw.
Okay, so and since we're going to be spending 3 hours with these lovely ladies, do you want to introduce these lovely ladies for us?
Absolutely. These are the greatest staff in Utah. We have Candace Wood, she's my surgical assistant, and Stacy Clark, our patient coordinator, and my daughter, Hadley Hamblin, treatment coordinator. So,
now, one question before we start this whole process. Once you put the implants in, how soon after can you start eating? How soon is the recovery time?
It kind of depends on how tight the implants go in, but sometimes you can eat that evening. But it depends on how the quality of bone that the patient has, how much bone they have. So sometimes you can eat a light meal that evening, but sometimes we ask you to go on a soft diet for a few days.
And the most important question for me is, do you have any laughing gas?
Yeah, we have laughing gas.
Yes, we got laughing gas, baby. That's all I wanted to know. When we come back, teeth in an hour or 22 minutes if you read the fine print. But we're going to be doing that when we come back. Are you ready?
I'm ready.
All right. We got teeth in an hour starting when we come back. Bye, guys.
Laughing gas for 3 hours.
We've seen laughing gas before.
That's just how we roll. Laughing gas.
See ya.
Bye, guys.
All right, we told you about sharks getting new teeth every 2 weeks, but Big Buddha can better that. It's actually in an hour, less than an hour.
22 minutes, I think.
Yeah, that's what they're doing. A new dental procedure called Teeth in an Hour this morning.
I don't think the procedure is called teeth in an hour. I think it's called something more scientific than that, like teethalosis tuberculosis.
You think so? No, I think when the dentists were coming up with this, that's what
the laughing gas is working, because that wasn't that funny, and Susan's laughing. It wasn't that funny. Let me see if it works. Knock, knock. Oh, look at that. Didn't even get to the punchline and she's laughing. Laughing gas is working. So, Dr. Hamblin, let's explain, we're not going to show it on Susan, but let's explain what you've done already so people at home kind of get a better grasp of what's happening.
Okay, this is a model of Susan's jaw, and basically this is all she has left is her front 6 teeth. And so while we were gone away at sports or weather or wherever you guys were, we
Potty break. We took a potty break.
Potty break.
Yeah,
okay.
Yeah.
Anyway, so we started to prepare the sites to place the implants using a precision surgical guide, which is generated from a CAT scan and a special software, and we'll show you the CAT scan and the software.
Is that to give you a more precise placing of where to drill?
Absolutely. The X-ray that we have in most dental offices is just called a Panorex, and that's a 2-dimensional picture. And in the CAT scan, the dental CAT scan, and I believe there's only one in Utah, gives us a 3-dimensional picture. So it gives us a very precise 3D picture of her jawbone, her tissue, everything that we need to see. So it makes it very precision.
So what is the scientific term for teeth in an hour? Do you have a scientific term?
That is the term.
I thought you were going to give me something.
Yeah. No, teeth in an hour is a term used by Nobel Biocare. It's the company that invented it. There's another procedure and is called teeth in a day. But the bottom line is you get your teeth right away. So it may take 22 minutes. It depends on the health and quality of the bone, but it may take a couple of hours.
Now, what are you going to use? What's the material that's going to be the replacement teeth made out of?
Well, the implants themselves are made out of pure titanium, and bone loves titanium. So that's where the research comes in. Is when we put in the titanium, the bone starts to grow and fuse with the bone. Now, the scientific term for that is osseointegration.
Yeah, I like teeth in an hour. We're going to stay with teeth in an hour. Hey, look, laughing again. The laughing gas is working. So we'll go ahead and work on Susan. And when we come back, we're going to just keep checking it. Can we just take a look at the progress? Is that possible? Is there any progress to be seen?
Yeah, I mean, basically, you'll see the little holes that we didn't make any incisions, but there's just little precision holes where the implants are going to go in. And we were just about to that point, and then so when we come back next time, we'll be placing the implants.
Okay. So when we come back, we're going to place some implants in there. And for those of you who are looking for some technical term, teeth supinolysis. Yeah, we're going to go with this. Is that okay? Teeth supinolysis?
That's our new term.
Say it.
Teeth supinolysis.
There you go. Teeth supinolysis when we come back.
You look really comfortable doing that.
Bye, guys. We'll see you in a little bit.
I can't remember. Big Buddha had a name. New teethiesis and an hourtis or something like that.
New teeth auriensis.
You guys, what is it?
New teeth auriensis?
No. Teeth supinolysis.
Supinolysis.
Oh.
Yeah, I read it in a book somewhere. Look,
You found it on the web.
Laughing gas is working good, man. That's what I'm talking about. So, Doc, walk us through what's happening right now.
Well, right now we're just going to show you putting an implant in. This is the implant right here. And
now, before you do that,
yes.
I want to warn people, there's no drilling. You're not doing any drilling right now. It's not going to hurt.
This isn't going to hurt.
Right.
I wouldn't call it drilling. We're screwing in the implant.
Okay, but it's already pre-drilled.
Pre-drilled,
Yeah,
yeah.
Okay. Just want people at home to know that.
And the light's off just for the cameras, and it just threads right in, and it'll get to a certain point.
Okay.
So now it's about halfway in, and then we'll torque it in the rest of the way with an actual torque wrench.
And Susan, since you can't talk, let's look at her feet for a response. 2 shakes if you're doing good. Okay. How about the between 1 and 10, the pain level, if there's any pain, between 1 and 10, tap your feet. No pain.
So this is just like a regular
like you're working on a car.
Like working on a car.
Okay.
You got to torque things into a certain...
Except it's in the mouth.
It's in the mouth. That's right.
All right, when we come back, we're going to go to the next stage of teeth supinolysis. Or teeth in an eye.
I'm sickos.
Yeah. She can't watch.
We'll see you guys in a little bit. Bye,
Drill
guys.
it in.
Oh, we got a thumbs up.
On a car.
No more.
There you go. We got a thumbs up. All right. Bye, guys.
See you, B.
All right, Big Buddha. This is teeth in an hour, but I don't know if I want to see it actually happen.
I don't understand. You can sit next to Dan for 3 hours, but you can't handle 2 minutes of that?
Well, that's what I'm saying. That's why she hacked on me. I'm used to it.
That should be a piece of cake. Seeing that stuff should have been like, oh, Dan,
You know what?
Dan,
You're
Dan.
right.
Yeah, you know?
Well, I'm immune now to his effect.
No, the whole process starts right here. Now, again, Dr. Hamblin talked about the CAT scan. Tell us what we're looking at and explain all this.
Well, this is the iCat, and this is a 3-dimensional picture of Susan's mouth. So in a normal office, you'd only see a 2-dimensional picture, and so planning out the surgery is not as precise. It's more exploratory. With the CAT scan, what we do is this is what we call a pan or X-ray, and then we take individual slices through this film, and we can see 3-dimensionally. So this tells me how much bone I have to work with vertically, but this is the floor of the sinus here, and this is the bone, and so we're placing the implant in right in here, or the implant's in right in here.
So tell us what you're looking at, just like you did with us off camera. What are we looking at right here?
This dark area here are the sinuses, the floor of the sinus. This is the lower jaw. Now this X-ray or this CAT scan doesn't show, but we put in I think 5 or 6 implants down here already. That was a few months ago, so she has lower teeth now.
Okay.
On her upper teeth, we're placing 3 implants here and 3 implants here. There's not very much bone. As I move the scan down just a little bit, she doesn't have very much bone back here, and so we're having to add a little extra bone back there to support the implants and anchor the implants in, so she'll have rock solid teeth when we're done.
Just so that we set a level of expectations for our viewers at home, how long does this process take? Because for television, we're doing it all in our live segment this morning, but how long does it usually take for surgeries to do all these surgeries that we've done for Susan?
You know, if we don't need to do add any bone, it really would take about an hour.
Okay.
But because we're adding bone to the sinus, today's process will take about 3 hours, the whole process. But we're putting in 6 implants, and we're also doing 6 crowns on the front teeth.
Okay. So they're finishing putting the plants in, the implants in. When we come back, we'll show you the finished product. It looks really, really good. Something you can bear even more so than Dan, Carrie.
I don't know.
See the soup analysis when we come back. We'll see you guys in a little bit. Bye, guys.
Thanks, Buddha.
See, I don't think it's that bad. I can watch, but then I can sit next to me also.
Yeah, you don't have to sit next to yourself. Right. Yeah, well, all those new teeth that lady's getting, they're going to be chattering when she heads out. Yeah.
All right, if you're squeamish like Carrie is, I don't know if this is the segment for you. They're drilling teeth into people's jaws.
We're still going to do that?
No.
Yeah, more drilling.
No.
There was only one time. I figured if you can stand Dan for 3 hours, you can stand looking at a tiny speck, drop minuscule thing of blood.
Well put.
No, we're done drilling. We're actually letting Susan take a break right now, and we're actually going to show you the entire process through this flip chart that Dr. Scott Hamblin has. So let's walk everybody through that. Lift it up here, and you're going to walk us through that. So
First off, but this is just showing 3 missing teeth here. And am I going the right direction? Let's go
from the
this
back.
way.
Yeah, from the
okay.
back.
So the first step in the process, and that's what we've done so far, we've placed 4 out of the 6 implants. Whoops, I skipped a step. So this is where we're at right now on 4 out of the 6 implants, and we've placed 3 on the upper right and 1 on the upper left, and between now and the next segment we'll place.
And it actually goes into the bone. Is that correct?
It actually goes into the bone, and then today we also are going to attach the posts or the abutments that will anchor the teeth in, and then the teeth go on top of that. So we're actually doing something similar to this, 3 teeth on each side. She doesn't have any back teeth at all, and so those will be rock solid when we're done. What happens over time when people lose teeth is their jaw actually melts away. And so this is showing a jaw with a full set of teeth, and this might be, you know, a few years later after having their teeth removed. And that might be 10 years later, and this might be 25 years later. And that's why people with dentures, a lot of our patients are people that don't have any teeth at all, and they've been told there's no hope, you can't, you know, you're just going to have to eat baby food and stuff put through the blender, and that's just not the case.
What's wrong with baby food? I like baby food.
Yeah.
Gerber is pretty good. You know, when you have the
stuff,
dessert, you should try the blueberry pie that's mixed.
It's been a while since I've had baby food.
I'm just saying, don't knock baby food, doctor.
Okay.
It's pretty good. All right. So, what about pain? People are thinking, oh, those are bolts and screws and stuff in the bone. It's gotta hurt.
Yeah. There's actually no real nerves in the bone, and so it's a lot less painful than having a root canal done or anything like that, because the teeth have nerves in them, and so.
What about when you bite into ice cream and it's really cold because it's titanium? Will it make everything else cold as well? Or
not at all. The titanium won't decay. There's no cold sensitivity. The only thing that you have to be aware of is you have to maintain them at home with good flossing and brushing, and they should last a lifetime.
Okay. Well, we're gonna check in with Susan when we come back, and don't knock baby food. I like baby food. Don't. All right.
All right.
You want to try some?
No.
Okay, just check.
I eat baby food.
I know you do, Dan.
But it's not the only thing that I eat, and that's the thing. You know, you don't want to be eating that the rest of your life.
I'm here to clear the record.
solely.
That is the only thing you eat. I've seen your bag. That's the only thing you eat.
It was on sale.
That's why Carrie doesn't want to sit next to you, because you eat baby food.
He's got baby food breath.
We're checking in with Susan when we come back. Bye, guys.
Baby breath.
Buddha hanging out, checking out the happy gas this morning, just making sure it works.
I just want to make sure that Susan is safe. So if the gas is not working, it sounds like it's working.
It's off now. We've got her off right now here for a minute.
So bring us up to speed. Where are we at now, Doc?
Well, we've placed all 6 implants, as you can see on the digital x-ray that we just took. That's a digital Panorex, so you can see the 6 upper implants that we just placed. And the 4 lower implants were placed a few months ago, so she's got lower teeth. The digital x-ray is about 90% less radiation than traditional x-rays. Now, if we look in her mouth, open a little wider. You can see way back here in the back, she has back teeth now. So before she came in, she had no back teeth. So those are temporary crowns. They'll be in there for a few weeks while the tissue heals and matures and the implants fuse or osseointegrate with the bone, or whatever that term we were using now.
Teeth analysis.
Teeth analysis.
Yeah. Why am I the only one that knows the term? No, just kidding. When we come back, thanks for the project. When we come back, we're going to step into the doctor's office. We're going to see some before and after shots, plus talk about the other procedures they have here. 801 is the area code. All smile. 255-7645 is the number to call. To see if Dr. Hamblin can help. But this is what it's all about. Susan, listen to this sound. She's been dying to do that.
It looked like you just ate her tooth.
No, it's candy. I'd show you, but Carrie's squeamish. But
yes, she is.
Can you see it? Yeah, okay. We're going before and after when we come back.
I get sick when I see teeth analysis or whatever. All right, thanks.
Well, apparently for Big Buddha, having teeth is all about being able to chomp down on hard candy. That's what it's all about. See, for me, I think it's all about, if I didn't have teeth, I'd look like this. That's not
It's
so
about
good.
his looks.
Yeah.
No, if I didn't want to do this, but since you brought it up, after the show, folks, when we're done, we're off camera. Dan takes all of that stuff out, and you made me do it. You made me do it.
Brush them on the outside and make sure I get them all clean.
Most of the time. Yeah, so you might want to come and see Dr. Hamblin, Dan, when we're all done with this. We wanted to show you some before and afters, just to show you what kind of magic, I'm calling it magic now, that this man works with. But let's talk about, you do all kinds of services. You mostly focus on the implants.
The dental implants and cosmetic dentistry. This patient here is a before patient. He drove up. He's mayor of a small town near Bryce
and he still got voted with his teeth.
Yeah. And I wish I had the after letter he sent us. He sent us a very nice letter. But this is afterwards. Wow. And that's just done with 4 porcelain veneers. Those are called luminaires. There's no shots. There's no drilling. Basically, it's a piece of porcelain, custom made to fit right over his.
I wanted to show this one as well. I don't know if you can get a shot of that. That's pretty dramatic. Dan and Carrie, that's pretty dramatic.
This person had a root canal tooth that went bad. We had to extract it, put an implant in, and then put a crown in there.
Wow.
And so dental implants are for replacing one tooth or a whole set of teeth. this case here, this was the after of Carlin. Carlin Johnson. That's his before, and that's his after there.
Very, very nice. Very, very nice.
These 4 are just porcelain veneers. They're called luminaires, and they're just bonded in, and it takes about 2 weeks lab time to get done.
When we come back, we're going to check on the progress. It looks, Susan's almost done. You're going to be amazed by the results. We'll tell you all about it. All Smile is the number, 255-7645, right?
That's right.
All Smile, okay? And we'll tell you if your insurance covers it, all that. We'll take care of all of that when we come back. We'll see you guys in a little bit. Results next.
Results. Okay, thanks. All right, let's go back to Big Buddha. He's hanging out in Sandy this morning at Hamblin Dental, and he's learning all about a new procedure, teeth in an hour. What's it called again?
Well, it's not the real term. This is a term that I just made up. I called it teeth supinalysis.
Oh, that's not the real term, really?
You really?
It sounds Latin to me.
It sounds believable.
I like it.
Yeah. Dr. Hamlin's like, no, it's not believable. So before we get to the big reveal and show the work that Dr. Hamlin's been doing on Susan, let's talk about insurance and all that. Does that cover it? Is every insurance different? Is every case different?
Every patient's different. Every case is different. With dental, if you have dental insurance, placing a single tooth implant versus doing a bridge where we have to grind down the 2 adjacent teeth, the fee's about the same, and a lot of insurances are covering that now. For someone who's missing all of their teeth, it can cost as much as a new car. And in 20 years, I've only had 1 medical insurance pay, but it was basically because a patient was starving to death. He went from 195 down to 135 pounds in about 3 months.
Wow.
With dentures, and then we put the implants in, and he started to gain weight back and doing great. So.
Just thinking along the lines of regular Joes and how regular people think, how good, people are at home watching, well, how good is he? What has he done? You actually used to be the team dentist for the Oakland A's, right?
Yeah.
Or for one of the Oakland A's. So was it Jose Canseco?
No, I was the team dentist for the A's.
Oh, wow.
Jose Canseco, Dennis Eckersley, all the old name guys. None of the new players that people know nowadays. But
how long were you the team dentist?
About 15 years.
Wow.
Yeah, I had a practice in Danville, California for 20 years. And we moved to Alpine in '97 for family reasons. I commuted for 8 years back to the Bay Area, to my practice there. And then so we've been here a year and just excited to be doing dental implants because that's my passion.
Again, just so that people are like, well, who's he worked on? Well, there you go. The entire Oakland A's, old A's, not new A's, old A's.
Yeah.
Retired A's. So let's reveal again. You ready, Susan? How are you feeling?
Fine.
No pain at all. You said you had no pain at all.
No.
Okay. So let's go ahead and show them off, doctor.
Okay. Well, if this is what she came in with, basically just 6 teeth in the front, and they were old crowns and no back teeth. And let's show her off. Let's see. She's got.
Look at that.
Now these are temporaries, and she'll come back, a few weeks later and get her permanent ones in. But this is the front 6 new teeth, and then if you can see way in the back, tilt her head back.
Yeah.
Can you catch that on the camera? You can see she's got all back teeth too, and those are solid. She can chew, well, maybe not the hard candy right away, but she can.
But soon.
Corn on the cob,
Okay.
stuff like that.
Well, doctor, thank you. We can't shake hands because I just saw where your hand went. But okay. Oh, there we go. Okay. Susan,
It was great
thank you
having you.
so much. All Smile is the number to call. 255-7645. We're out of time. You got a great smile. We'll see you tomorrow on Good Day Utah. Say goodbye for me, Susan.
Bye.
Thank you.
See ya.